Well, Dr. Ghatan, you're a dermatologist. Please tell us a little bit about skin and skin cancers. The major skin cancers, how we can recognize them and how dangerous they are, and maybe tell us if there is a way of how to protect ourselves to get it in the first place.
Sure. There are basically three major skin cancers. Basal cell carcinoma is the most common skin cancer, and oftentimes it's a very slow-growing cancer. It looks like a pearly papilla, pearly growth, and sometimes you notice some broken capillaries on it. Or sometimes it could be some, like a pimple, people call it, that it doesn't heal. It comes and goes, they put acetyltracycline on it, put antibiotic on it, it just doesn't go away. It gets better and it comes back again. In general, you tell people, anytime you see something that comes and goes but it doesn't go completely, it's time now to have a dermatologist check it out, make sure it's not a skin cancer. Squamous cell carcinoma is the second most common skin cancer, and that also looks like a ulcerated, crusted growth that can slowly get bigger and ulcerate more. And again, that would be a non-healing lesion. The third most common skin cancer is melanoma. Melanoma, usually it's like a mole, but it has different colors. It's not a uniform, say, brown color. It could have shades of brown, blue, or black. In general, if there's any mole that's very dark, very black, you would like to check it out. If it's different colors, you would like to check it out. These are the most important criteria, but there's an ABCDE of melanoma. A referring to asymmetry, meaning that if you have a mole and you put a line in the middle and divide it up, one side would match the other side in terms of symmetry. If it's not as symmetric, then that's one criterion that you have to look at. B stands for border. If the border is smooth and regular, that's usually a good mole. If it's irregular, then that's something also to consider. C is the color, which we discussed already, and I believe that's the most important criterion to have in mind. D is dimension. Usually if it's bigger than the head of a pencil eraser, you have to...
Bigger than what? You broke up a little bit here, Doctor.
A pencil. Head of a pencil eraser.
I see. Okay.
Yeah. So these are the basic things of the skin cancer. For the most part, they do have a very high correlation with sun exposure, meaning the people who've had sunburns, who have had a lot of sun exposure, are much more prone to get these skin cancers. There are situations where people are immunocompromised, they're on medications, say post-transplant, kidney transplant or other transplant, they're taking medication that decreases their immunity. In that kind of situation, they are more prone to, for example, get squamous cell carcinoma. So those people are people who are going to be observed by us more rigorously. We're going to see them more commonly every 6 months or a year to have a complete exam. In general, we do suggest that everybody should have a complete skin examination at least once a year, especially if the person has many moles. Anybody who has more than 100 moles on the body is at a higher risk of one of those moles changing at one time or another to a melanoma. People who have congenital nevus, meaning a mole that has been present since birth, and by that I mean anywhere from birth till about 2 years of age. That's considered since birth. If it is above certain size, then we know that there is increased risk of it turning into a melanoma. So a larger mole, again the dimension, which is important, needs closer observation and maybe some biopsies. So those are the basics.
Yeah. Are any of them more dangerous in terms of creating other illnesses, maybe even dying or something like that?
But melanoma is the most dangerous one, which can metastasize, which can go to other parts of the body, and it can be a killer.
It can be, yeah?
It can be, but look, if it's cut in time, it depends on the depth of the penetration, how deep it is. And when we take a melanoma out, we send it out to laboratory and they check on the microscope. They tell us how many millimeters it is that has invaded. And based on that, we have criteria. We can tell, well, look, you're in a group. We can tell you, pretty accurately that you couldn't be completely cured. Or we can tell you, probably have about 60 to 70% chance of survival for the next 5 years. So the depth is important. Obviously, early detection is very, very important. You can save a lot of lives by early detection.
So if a person gets any of those three cancers, especially the melanoma, the dangerous one, is it actually possible for a person not to realize that he has it, to kind of just write it off as maybe an insect bite or just whatever, scratchy skin or so? Is it possible for a person to just fly by it and then years later, by accident, some doctor looks at it, realizes it, and then it's kind of too late?
It's very possible, especially the change in the color may be very slow, and patients may not be cued into noticing the change. Or it could be a mole that's in more of a hidden place, say it's on the scalp, in the hair area, on the back, in the private area, and on the buttocks, areas that one may not notice so easily. So that's why it's important to have a qualified dermatologist examine the patient to look for these kind of things.
I see. So it's not necessarily as obvious as an acne, for instance, which is like, it's hard to oversee that you have acne, or at least that something major is going on in your body. So you're saying with those things, it's not always as obvious.
Right, but some patients they say, well, doc, I had this mole for a long time. It doesn't hurt me. It doesn't itch me. Nothing. I tell them, look, by the time it hurts you, it's going to be too late. So it's a lot of times these are asymptomatic. There's no symptoms. There's no itching. There's no pain. There's no, they're just subtle things that we can recognize. The patient may not recognize, and we can catch it early and help them.
Okay, but your last statement does make me believe that at the very least there is something there which makes the skin looking different, not totally normal. Discoloration, something is there which by regular washing and whatever, a person would eventually notice and go, this isn't quite like the rest of the skin, and by doing so it might not hurt, it might not itch, it might not do anything. He should go and get it checked. That's basically what you're saying.
Yes.
Okay. Well, wonderful. Thanks for letting us know, Dr. Ghatan. Thank you very much. Bye-bye.